Hi, good afternoon, and welcome to the MDPCP Primary Care Staff Training Academy. I'm your host, Angelica, and I will be assisting throughout the afternoon with the training. So first, I want to thank you all for attending this webinar. Our presenters have put together some great content, and I hope that you can learn something from it. So before we get started, there are a couple things that I want to go over with you guys. So first, this training will be recorded. And I also want to point out to you on the GoToWebinar control panel, if you are able to expand that, and while you are waiting for us to kick things off, there are a couple of features that you have access to. So what I want to point you in the direction of are the handouts. So there are 3 handouts that are uploaded for you to download. The 3 documents include the curriculum, which has an agenda and also the training objectives for each of the sessions we have planned out for today. Where there's also a document with handouts. It has a whole bunch of handouts that each of the presenters will be referencing throughout the training material that will be delivered. The last training or the last document that is uploaded is the PowerPoint presentation in PDF format that we're sharing on the screen now with you today. So another feature on the control panel is the chat box. So we will address all the questions at the end of the training session. So as the presenters are delivering the training content, if you do have any questions, feel free to type those in the chat box. We do have someone that is monitoring those questions. And at the end, we have reserved some time to answer those questions. All right, so a couple other things that I want to bring to your attention is this training activity was approved by MedChi for 3.5 credits that you can apply for if you're interested. So after the training, you'll receive a follow-up email with instructions and a link to apply for the credits. For the non-physician attendees, you can apply to, you'll receive an attendance certificate, and then you'll just have to check with your accrediting or credentialing organization to make sure that they accept the CME credits. And most of those credentialing organizations, they do accept those to some extent or another. Another thing within that follow-up email, there will also be a post survey included. So really wanted you to please take some time to fill that out. We want to understand what you've learned from this training session, and then we would also like to see what type of topics you would like to see on the future trainings. All right, so for today's training, there are 4 sessions that will be covered. The first session will be covering an overview on the MDPCP program. The second session will be covering quality improvement, team-based care, and also dealing with change. The third session will be covering the patient journey before, during, and after the patient visit. And then the last training session will be covering additional activities after the patient visit, in addition to the social determinants of health and patient engagement during the COVID-19 and beyond. All right, so before we officially kick the training off, I would like to introduce our awesome presenters. So again, I am your host, Angelica Ortman, and I have over 13 years of experience in the healthcare industry, and I am an executive consultant in population health management with Medical Links. And some of my key areas of expertise include quality improvement programs and methods, practice transformation, healthcare payer experience, and program management. I hold a double master's in healthcare and business administration, and I'm currently pursuing a PhD in community health. For our first presenter, it will be Dr. Howard Haft, and he has 27 years of clinical experience in primary internal medicine and 10 years of hospital-based emergency medicine, clinical, and leadership experience. He was founder, president, and medical director of Maryland Healthcare Associates, where he established a multi-specialty medical practice. Additionally, he was a founder and president of the Maryland Foundation for Quality Healthcare, which provided healthcare education to uninsured and underinsured Marylanders. Dr. Haft served as Chief Medical Officer at Health Partners, a Waldorf-based charitable clinic serving Charles County and surrounding areas. And in 2015, Dr. Haft was appointed as the Deputy Secretary of Public Health at the Maryland Department of Health. Currently, Dr. Haft serves as the Executive Director of the MDPCP Program and provides leadership and oversees the day-to-day operations of the program. So our next presenter is Dr. Nkem Okeke, and Dr. Okeke is a Kaizen-spirited healthcare executive with 20 years of experience in primary care and patient-centered care redesign. In the last 10 years, she has led and supported several primary care transformation and population health initiatives and focused on provider engagement, quality improvement, and payment reform. She served as the National Learning System faculty lead for Comprehensive Primary Care Program, also known as CPC Plus, at Booz Allen. And she served as Special Project Director for Population Health Initiatives for Priority Partners at Johns Hopkins Healthcare. And that's actually where I met her. Before that, she served as the Regional Telemedicine Coordinator at Kaiser Permanente prior to joining Johns Hopkins. She is the founder and chief executive officer of Medical Links, a healthcare advisory and population health management firm here in Maryland. And her passion is to better integrate healthcare delivery systems. For session 3, we have Yayo Kamara as the presenter. She's a senior clinical coordinator with Medical Links. And Ms. Kamara began her career as a registered nurse and has over 8 years of experience in nursing. She holds an MBA and a Master's of Science in Nursing from Marymount University. And Ms. Kamara is not only a nurse at heart, but she's a nurse practitioner with a strong background in primary care, urgent care, and also care management. Our last presenter is Ashley Johnson, and Ashley is a community health worker supervisor with a background in behavioral health. She has over 12 years of healthcare experience with an emphasis on mental health and substance abuse. Ashley supervises a team of 12 community health workers aimed at identifying barriers to care and eliminating social determinants due to lack of community resources and support. Ashley is currently pursuing a master's in social work, and she has a passion for improving healthcare disparities. So those are our awesome presenters. One last thing to mention about them is that all the presenters here have no disclosures related directly to this presentation. So that actually concludes the open remarks for me. So without further ado, I'm going to turn it over to Dr. Howard Haft and the first training session.
Thank you very much, Angelica. It's my pleasure to be here today, and really exciting to be here with in this virtual format for the staff training academies. And just want to point out that the staff training academy, in my presentation, I will focus a bit on Maryland Primary Care Program, kind of the roots of where that got established and why it got established. But the things that we will talk about during the course of this presentation is largely about how staff and practices can adapt to advanced primary care. So that kind of cuts across all programs and all types of practices. This particular program is focused on the program year 1 practice staff for those who are in MDPCP. So those are new starters, and this has been particularly a challenging time, we understand, to be a new starter in a program. January might have been just getting your feet wet, and February a little bit warmer, and then we dove into the COVID pool, which has changed the whole world. So that's why we're doing this in a virtual way, and but we'll still be able to present to you what the past, the current, and what the future looks like in terms of advanced primary care. And next slide. So I really want to start out here, I think most appropriately, by thanking all of you for everything that you've done in the past, what you're doing now, and what you'll do in the future, because this episode of COVID brings to light the fact that you really are the healthcare heroes. Seeing people in your practices in tents, seeing them in the office in challenging situations, doing telemedicine, all those things that we've had to pivot to suddenly really defines heroic work. And I just wanted to start by thanking you all for what you do. Now we'll talk about some nuts and bolts. Next slide. So we have to think about why we do things, because that's really what propels us forward with great energy. It's not the what we do, but the reasons behind it. And I think that's a great case in point is you're out there still taking care of people every day. And it's not the what you're doing, but you're doing the why. You're doing it because that's what you do. You're healthcare providers. This is in your DNA. In the same way that JFK said in his speech to the graduating school at Rice University in 1962 about the moon launch, said he never got to see us go to the moon, but he did say we chose to go to the moon this decade and do other things, not because they're easy, but because they are hard, and the goal will serve to measure the best of our energies and skills, because that challenge is one that we're willing to accept and we're unwilling to postpone, and one which we intend to win. Boy, doesn't that really describe the challenge that we're in now? Testing the best of our skills, but working together, we're going to get through this. So it's the why behind it. Next slide. So COVID-19 is really also very clearly defined a very important role for primary care. Primary care providers and staff are absolutely in the front line in the battle against COVID-19. It's because of the work that you all do by identifying those high-risk patients, by reaching out to your patients through telemedicine, by giving them important messages, whether it's through the physicians or the care team or others, that says stay at home, stay safe, that keeps them out of harm's way and has kept us, in addition to the mitigation things that we've done, the stay-at-home orders, et cetera. But that's kept us from being much, much worse than what it could be, and particularly worse in terms of the light of those critically ill patients who would really suffer if they got in contact with this virus. And you continue to be uniquely positioned to give those messages to your patients. Using telemedicine has been just an incredible boon to be able to do that. And it's amazing how we've adopted to that and adapted it so quickly. And the role that you will play in this epidemic will continue to mature and change as we go through it over the next several months or however long it's here, including testing, including contact tracing, and including now getting back to establishing the usual way that we care for people for their acute and chronic illnesses. Next. Here's a little inspirational video that I'd like you to take a look at, see if we can play that.
Thank you. It's something we say all the time. Mostly, it's a response to something small. A door held open, a compliment. It's just something we say often without much thought. But now, maybe more than ever, we're all thinking about what we're thankful for. While many of us, hopefully most of us, stay home to flatten the curve of COVID-19, there are others who show up every day on the front lines. Nurses, doctors, healthcare providers, and the people who support them. People who risk their own safety to help us all. We are all showing them how much we care. Scratched in chalk on the sidewalk outside of a hospital, held up high on a poster, even written on the back of a pizza box. But there are more ways that we can show our thanks. We can thank them by continuing to stay home and flatten the curve. We can thank them by recognizing that, even though it's hard for all of us, it's hard for them too. Thanks, Health Heroes, because that's exactly what you all are. Heroes.
Okay, next slide. So again, thank you so much for what you do. I like that little video. It just shows in so many different ways how this is the moment for healthcare and how we've stood up and accepted the challenge. And we're doing it because we're here to provide the best quality healthcare for all Marylanders. Part of our program, the Maryland Primary Care Program, also is to shift from the volume demand to value. And clearly, we've done that right now. We're all about value and not about volume. Avoiding unnecessary emergency department and hospital visits. And when you think about it, how bad the state would be if we didn't have a well-organized primary care workforce like this in a public health crisis. To think about a fragmented workforce that wasn't prepared to care for patients in this complex environment that we have now. So this is really when we show Maryland how important we are, because this is really our calling. Next. So primary care has always been kind of at the bottom of the pecking order in terms of relative numbers compared to the specialists and others. This is really calls upon us to work even harder. And you can see in this slide that as compared to other nations, we really have a far fewer percentage of primary care providers. And it's interesting to see that in those other nations that have more primary care practices and providers, that they actually do better in terms of overall outcomes and lower costs. So it's one of the reasons why we're doing this program, is that we want to strengthen primary care, and by doing so to be able to improve the outcomes and the quality of the people that we serve, and also reduce the costs. Next slide. So we started this program when the governor signed July 9th of 2018, this total cost of care model contract, which commits us to at least 8 years, and if we're successful, forever, to have advanced primary care in the state, supported by care management fees and other supports, so that we can do the best job possible that we can. And what we're going to talk about now in this ensuing slides is just a very high overview of what all of the elements in advanced primary care are, so you can get kind of a view of the broad aspects of it. In the subsequent several hours, we're going to do a deeper dive into each of the really important aspects for staff level. And then from the handouts and others, you'll get even a deeper look at that. And just to let you know, we'll be working with you side by side throughout the entire course of your engagement in Maryland Primary Care Program. Next slide. So here are the elements of that larger model. Included the primary care program, that's MDPCP, but also population health and the hospitals committing to reducing the total cost of care and accepting the responsibility for the populations that they serve, and then broadly care redesign. Next slide. Here you can see what the extent to which the Maryland Primary Care Program has had an impact in terms of numbers of practices and sizes of practices across the state. So this is based on the first 2 years of enrollment. We're just starting the third year now, and we'll fill in even more of those dots. But you can see it's broad, it's large, it's probably the largest program like this in the whole nation. So you're part of a very strong program. Next slide. So now we're just going to walk through what the requirements are for advanced primary care. There are these 5 requirements that we consider what is essential to consider a practice fully fledged as advanced primary care. And if you're not there already, you're going to get there with a lot of our help and assistance and a lot of work and innovation on your part. But it includes access and continuity, care management, comprehensiveness and coordination of care, beneficiary and caregiver experience, and planned care for health outcomes. So the next set of slides will just really superficially kind of say exactly what's in each of those 5 elements. Next slide. So first is in access and continuity. What this is about is a really important thing that says the more opportunities I have to connect with my patients, the better off I'll be and my patients will be. So first, it's understanding who your patients are, doing something called empanelment. Say, these patients belong to this doctor and this care team, and these patients belong to that doctor and that care team. And then providing those patients with 24/7 access, whether it's by telemedicine or a call-in number or something. And then even expanding the ability to have more, in the past, it was more face-to-face visits. Now it's more telemedicine visits. Eventually, we'll get back to more face-to-face visits and more office hours. But just making sure that your patients know that you're there for them when you need them, when they need you, and that you're competent and you know about them. And then also adding in home visits and home monitoring, other kinds of things as you progress through the program. That's all about access and continuity, critically important. Next slide. And then really one of the strong pillars that this program is built on is care management. Every practice having a dedicated care manager, either full-time or part-time, and that care manager doing data-driven care management, risk-stratified patients, understanding who the vulnerable patients are. Wow, has that really become important in light of COVID? Because we know those vulnerable patients, the ones that we've given you data about, that says here's your 4s and 5s, here's your high risk for preventable, avoidable hospital events. Those patients are the ones who really need special care and attention to keep them out of harm's way. They always do, but they particularly do now. So the fact that you have that data available through CRISP is just critically important. And then be able to do short and long-term care management programs, following up after hospitalizations or emergency department visits, and then building where necessary care plans and medication management for those high-risk patients. This is, again, really important. And this is something that we've brought to the state of Maryland that largely primary care did not have before. And now, virtually for all of our practices, we can say, yes, we're doing this. Risk-stratified care management. Amazing. Next slide. So, and then there's comprehensiveness and coordination of care. This is where primary care, which has been constricted in many ways previously because of financial and other concerns to doing, very, very basic care. This is where we say there's really important things that we have to attend to for our patients, that we need to be able to expand the scope of what we deliver. One of those things is integrating behavioral health, and that's become a cornerstone of what we do. Every practice finding the ways, either through screening, brief intervention, referral to treatment, SBIRT, or collaborative care, or co-location. And you'll learn more about those things as you go along. But being able to say, we can deal with not only our patients' physical needs, but we can deal with their behavioral needs, their mental health, and their substance use problems, which now, in light of COVID, again, have become much, much more acute. And then also we can coordinate with our specialists in a way that makes the handoffs of care coordinated, efficient, and cost-effective. And then also that we can identify the social needs of our patients, which really significantly impact the outcomes. That is, certainly people who living in poverty or in homelessness or are not well educated or have other social issues will be needing other kinds of supports than you would for a patient who is on the other side of that curve, who is wealthy, well-educated, living with great independence and great transportation access. So understanding those things and then being able to link those patients to resources that can help them move higher up in health equity. And that's also a very important part of this, including being able to provide food and caregiver support to the patients. All those are resources that we help you provide within the program. Next slide. So beneficiary and caregiver engagement, this is a very interesting process that all advanced primary care programs have that say, you ought to really ask your patients what you're doing right and what you're doing wrong in a casual atmosphere, the patients and their caregivers, so that you can learn from their view of how care should be delivered, as well as your view of how care should be delivered. And it's very often an eye-opening experience where patients will say things like, it took me 3 weeks to get an appointment, and it's because I said I'm just coming in for a routine problem. But nobody asked me what that routine problem was, and the routine problem might have been a urinary tract infection. Or somebody saying, I'm uncomfortable with sitting so close to other people in your waiting room. And that leads to a different strategy in terms of waiting rooms, or any one of 1,000 things that can lead to seeing things differently. And these are nice things to do, and for the most part, free all the time. Both the providers, their staff, and the patients learn a lot about each other and and advance in terms of their ability to provide best care after these kinds of gatherings. And it's also an opportunity in this particular piece of the work that we do to focus on advanced care planning. And advanced care planning right now is really critical, making sure that all of our patients particularly have defined, if I get COVID or any other condition, how I would like the end of my life to be metered out if I'm not able to make those decisions myself. Think about that. It is so important right now. Next slide. And then there's planned care for health outcomes. That is data-driven quality follow-up and quality improvement. And we are just really wealthy with data in this program. This picture here is a picture of data that we've been able to develop that shows in a particular area where all the high-risk COVID patients are. Each of those dots represents a patient, and in your database, you can see you have data about each of those patients, what their social risks are, who they are, where they live, and you can focus on that. And you can also focus on areas of concentration if you had a program that you wanted to go out into the community. And all that lets you really drive your quality based on data. And this is really a very data-driven program. Next slide. So there's lots of support. All this that I just mentioned sounds very daunting. Wow, how do we do all this? Particularly now, how do we do all this in light of all these other things and pressures that we're under? Well, we do have care transformation organizations that serve the majority, I think about 75% of all of our practices, and they provide technical assistance and support. We have coaches that support every one of our practices. We have CRISP tools, that is the data and other tools that are given to you on your MDPCP dashboard. And then we have a very extensive learning system. This is part of it, but we also have many, many other parts of that learning system. And things that, if you have any need in terms of technical assistance or learning, we're absolutely here to support you, either at your elbow or in a video way like this, or whatever it takes. These are things that take time to get through, and things that get through better with support, and quicker with support. And that's what we're all about. Next slide. So here's just some of the things that the care transformation organizations do. They provide care managers, pharmacists, LCSWs, community health workers, and this whole range of services that can be provided to you through your care transformation organization. Not every practice needs one. Not every practice wants one. That's an election that you make. But if you have them, make sure that you use them to the greatest extent that you can. Next slide. And here's some of the things that CRISP provides to you. And I won't go in detail of all these things, but it's just a wealth of tools, from care alerts to reports to the ability to do your quality reporting, to the drug monitoring programs, to event notification, et cetera, et cetera. Every one of those is a wonderfully effective tool. Next slide. And here's part of what the learning system brings to you. Coaches, both the state coaches and the care transformation coaches, webinars, which now we do on a sometimes daily basis, even today, twice daily, the training academies, office hours, manuals, collaborative communities, newsletters, a Connect site. If you haven't lined up with Connect already, you should do that. It's like Facebook for all our MDPCP practices. And then face-to-face meetings, which I promise you we will get back to. And when we do, we'll celebrate those. And then reporting on a variety of different issues. Next slide. So I think that's the end of my presentation. I wanted to make sure I left plenty of time for all of the other presenters that are here, and we'll look forward to at the end to your questions that might be in the chat box. Thank you for what you've done. Thank you for what you're doing now, and thank you for what you're going to do in the future. God bless you.